To the average Canadian, this might look like a typical carton of milk, handful of almonds, or peanut butter sandwich. But to some 400,000 Canadian children, these can be a severe allergic reaction waiting to happen. Or is it? More and more new medical studies are emerging that dispute almost everything we thought we knew about allergies. One Ottawa allergist, Dr. Zave Chad, sets the record straight. According to Chad, parents were once told to delay the introduction of allergenic foods. That may no longer be the case.
The newer recommendations that we're giving for parents who want to try and prevent food allergies is actually earlier introduction, and there have been studies that show that if you give eggs in the 4 to 6 month range, there's a significant decrease in egg allergy than giving it at 11, 12 months when we used to.
Since 2010, CHEO reports having seen between 300 and 400 kids come through the emergency for anaphylaxis, a potentially fatal allergic reaction to a food, drug, or environmental element. Of those visits, over 70% were triggered by foods. The most common allergens? Peanuts, tree nuts, and milk. And whether or not a child develops allergies is based on many factors, or something called epigenetics.
Epigenetic, like you're born with a tendency to develop allergies, yes or no. That's in your genes. But it's the environment that determines whether or not a lot of those genes are going to express themselves.
But just because a patient could be predisposed to allergies, it doesn't mean testing is the answer. In fact, Chad advises parents to not get their children tested before they've actually had a reaction.
If they can eat the food with no problems, why do the test? And that's exactly the point. You don't do tests if they're eating a food with no problems.
But if parents are concerned, Chad says there's no harm in consulting a physician.
Okay.
This is Dani-Elle Dube with the Ottawa Sun.